is Angie Morales, and I'm here to share my experiences from my placement that I did at the Ronald McDonald House when I did my SSW diploma, and my work experience at Wesley with their Wesley Supportive Housing and their dual diagnosis department. So as I mentioned before, I did my placement at the Ronald McDonald House, where I was able to support families of hospitalized children by assisting them with meals, clothing, snacks, either at the house or at the hospital with their family rooms. And this experience allowed me to witness the emotional and physical challenges that these families face and reinforce the importance of being compassionate and family-centered support in healthcare settings. As I mentioned before, I have also been working at Wesley for over 2 years as a client care worker in their dual diagnosis program. In this role, I have been supporting individuals with emotional regulations during times of distress, facilitated recreational activities, completed documentation, and assisting them with medication and accompanying clients to appointments. And this program, we have been working as a team and in partnership with the YWCA. So in total, we have 10 clients where Wesley takes care of 7 of them. And this is a net residential setting as well. So what I have been taking from both my placement and my work experience has been the importance of the emotional support and being kind in easing the stress that families are facing when they're facing like a medical challenge. I have been also been able to effectively assist individuals at their dual diagnosis by using patients to being able to have active listening and support strategies to better integrate them, not just in the group setting, but also in the community by providing support with maybe volunteering experiences or like working if they have the capacity and if they feel like they want to do it as well. And I have been also learned the significance of maintaining good and clear documentations and structured care plans to ensure the continuity and quality of the support services that we're giving the people that we are supporting. So what I'm interested for my 4-year placement is I'm particularly interested in a healthcare setting where I can work in an interdisciplinary collaboration to learn how social work integrates with a medical care. So how is the communication between social workers, doctors, nurses, and different healthcare providers. And I'm also particularly interested in a mental health setting with a focus on therapy, when I can interact with diverse populations and gain hands-on experience with different therapeutic models like CBT or TBT. An environment that will help me to, the reason why I want to work in these settings or to have the experiences in those is because this will help me to build a foundation of skills for my long-term goal, which is having a private practice in the future. So the skills that I'm hoping to develop in these placements are collaboration skills, being able to work closely with doctors and nurses and other healthcare providers, as I mentioned before, to create a better care for patients, crisis intervention skills that will strengthen my ability to support individuals is experiencing mental health crisis through effective interventions, and being able to work by de-escalating and conflict resolutions, enhancing my ability to help individuals struggle with emotional regulations by using calming and solution-focused approach. So these are like the new challenges that I want to take, and I'm looking forward to doing in my 4-year placement. And thank you so much for listening.